Hello everyone, today I will discuss a topic which is known as pulmonary edema. In this whole we will discuss the concept of pulmonary edema, classification of pulmonary edema, clinical features, how you will diagnose this condition and treatment of pulmonary edema. सबसे पहले पल्मोनरी एडिमा के कॉन्सेप्ट को समझते हैं। पल्मोनरी एडिमा एक ऐसी कंडीशन है जिसमें फ्लूइड एक्यूमुलेट हो जाता है इनटू द लंग स्पेशली इन एयर सैक्स और एल्वेलाई मेकिंग द पेशेंट मोर डिफिकल्ट टू ब्रीथ। Patients with this condition have a symptom of shortness of breath, coughing with sputum, wheezing, or a feeling of drowning or suffocation. Now we have a classification of pulmonary edema. One is known as cardiogenic pulmonary edema and other one is known as non-cardiogenic pulmonary edema. Now we have classification or differentiation between cardiogenic and non-cardiogenic pulmonary edema. इनके नेम से पता चल रहा है cardiogenic pulmonary edema related to heart है and non-cardiogenic pulmonary edema related to any other cause. In cardiogenic pulmonary edema we have some serious findings. First of all, jugular vein distension. As we know that jugular vein is a direct extension of superior vena cava. Due to increased right atrial pressure, jugular vein become visibly distended. Second one is we have S3 gallop, which is a early diastolic heart sound that occurs just after S2 during rapid filling phase of ventricle, commonly heard due to left ventricle dysfunction. Pulmonary edema due to fluid accumulation in the lungs. These all are normal in early stages of non-cardiogenic pulmonary edema. Cardiomegaly is also present in cardiogenic pulmonary edema, which means increased size of the heart. On the other hand, normal size in non-cardiogenic pulmonary edema. Pleural effusion is common in cardiogenic and uncommon in non-cardiogenic pulmonary edema. Curly B lines are the thin horizontal lines which can clearly see on the chest X-rays, typically at the lung basis. These all are due to the fluid accumulation in interlobular septa. In curly B lines are not present in non-cardiogenic pulmonary edema. In cardiogenic, there were clearly seen engorgement of vasculature to aphesis, and in non-cardiogenic, there were no engorgement. Now in this slide, we can clearly see the jugular vein distension and curly B lines present on the chest X-ray. Of cardiogenic pulmonary edema, which is a type of pulmonary edema. In this condition, heart fails to pump blood, leading to increased pressure in pulmonary blood vessels. This pressure causes fluid to leak from capillaries into lung, air sacs, or alveoli. Worst form of CHF is cardiogenic pulmonary edema, where heart's left ventricle cannot effectively pump blood, leading to backup of pressure into the lung. Here are some contributing factors related to this. First of all, we have left side heart failure, most commonly left ventricular dysfunction, in which heart cannot pump blood effectively, which leads to fluid backup into the lungs. Hypertensive crisis, which leads to increased blood pressure or increased pressure in pulmonary capillaries. Third one, we have valvular heart disease, which include mitral valve or aortic valve stenosis or regurgitation, which also leads towards blood backup into the lungs. Cardiomyopathy, which means weakening of heart muscles, which also cause fluid accumulation or blood backup into the lungs. In this chest X-ray, we have some clinical findings related to cardiogenic pulmonary edema. First of all, we have bad swing pattern, which is due to acute pulmonary edema. Size of the heart also increases, or blunting of costophrenic angles is due to pleural effusion. Features, which means what were the signs and symptoms in this condition. Patient have shortness of breath, difficult breathing, wheezing, or coughing with sputum, rapid or irregular heartbeat if this condition is related to cardiogenic pulmonary edema. Patient have anxiety or restlessness, cold or cyanosis, or profuse sweating. Investigations related to this condition is physical examination, chest X-ray for fluid accumulation, ECG for detection of heart rhythm abnormalities, blood tests which include brain natriuretic test, which is a biomarker for diagnosis of cardiogenic pulmonary edema, echocardiography for heart function or structure. What's the treatment of pulmonary edema? Give patient oxygen therapy to improve oxygen levels. Give patient diuretics like furosemide to remove excessive fluid from the lungs by increased urine output. Give patient vasodilators which include nitroglycerin which leads to decrease in blood pressure or decreased heart workload. Give patient positive inotrope agents, which include dobutamine, which helps strengthen the heart pumping ability or heart contraction. Addressing underlying cause means treating conditions like high blood pressure or heart valve disorders. I hope you all understand the concept of pulmonary edema. Thank you.